In this range of motion testing, we're going to be covering hip adduction, ADduction, meaning bringing towards the body. Our optimal range of motion here is going to be 30 degrees. Now, in terms of restrictions and what we're going to be looking for from a muscle and joint perspective. From a muscle perspective, we're going to be looking at the TFL, the glute min and the glute med, and the medial portion of the capsule from a joint perspective. Now, setting this up, I'm going to show you something a little bit different than what you might be used to. A lot of textbooks will show adduction doing this, coming across the body. The problem with this, and when you think about this logically, is as soon as I lift up this foot and come across, what's happening to the pelvis? It starts to rotate. So it's very challenging to get a good reading coming across the body by bringing the foot up and over. So a way I like to teach this is by bending the knee, getting this leg out of the way, and then doing your adduction. So let's go through setup here. We have the piece of tape right at the front portion of the ASIS, so follow that pelvis along where it comes down and that bony process stops, right through the femur and in line with the middle of the patella. This is going to be our measuring or our long lever arm. We're going to bring this knee up. Now, two things that you can do is you can have your client assist you with this, or you can also do this, but you want to make sure that the pelvis does not rotate at all during this test. As soon as that pelvis starts to move, the test is over, and that's where you take your measurement from. So what we can do is have your client, so take both your thumbs right on the top of your pelvis there, and usually what I say to the client is, okay, we're going to do this test, let me know as soon as your pelvis starts to rotate. Don't let them know how far you want this leg to go, because they're going to lie to you. Clients don't like to fail a test. So just let them know, saying, hey, we're going to be doing a little testing for this leg. Let me know the second you feel that pelvis starts to shift, okay? So from this position here, that knee is now out of the way. We have our long lever arm here and this leg ready to go. We're slowly going to adduct this leg and let me know, oh boy. One more time, come across, and we already have that pelvis starting to shift. Now we can also come along here and just keep your thumbs. So come down for 1 second. Okay, pelvis lined up here, slowly bend this knee. So I can watch these thumbs, and you can see right there that thumb starting to rise. So keep this up for me for 1 second. So right there. Go back to our goniometer. We have our long lever arm, and we have an impressive, a staggering 15 degrees of adduction, which is far below what we want in our 30 degrees. Now again, if I were to take a guess, what do you think it would feel like if I start probing that glute min and that TFL? She's like, please don't do this again. So as soon as we get into this area, she's not crunching right now, she's in a little bit of pain, and then through this area, we have a lot of tightness. When everything surrounding this area gets very tight and restricted, it's going to impede the ability to move through here. And what starts to happen is as soon as she goes into adduction, can you feel your pelvis, how much it's shifting? So if we want to actually go through a full 30 degrees, hold that for 1 second for me, please. Let's just see the effects of the body. So this is where we need to be. So let's come across, come across, come across. That's where her legs should go. Look at the difference in her pelvis now and how rotated that pelvis is, meaning that anything that she does that requires any adduction will actually start to come from the pelvis, which now means QL is affected, psoas will be affected, and everything else through here in the lower lumbar spine and portion of the T-spine is going to be affected by lack of mobility in this area. Good.